Hello everyone, welcome back to my channel. Namaste to all gadgeted officers, IAS, IPS, doctors, surgeons. Knowledge is like digestion, just as our small intestine absorbs the nutrients that keep us alive. Learning absorbs the wisdom that helps us grow. Every concept you understand today, you are going to learn today, will become a stepping stone for your success in different exams, especially NEET, AIIMS, UPSC, BPSC, and also in life. Remember, the small intestine teaches us an important lesson. It works quietly, tirelessly, and efficiently without ever seeking attention. In the same way, your consistent efforts, even if unnoticed today, will one day bring you great results. Keep learning, keep believing, and success will surely follow you. So, we are going to learn about small intestine, its anatomy and function disorders. So, welcome back to our gastrointestinal tract series. In today's part 8, we will explore the small intestine, its anatomy, layers, blood supply, function, some important disorders, anatomy of a small intestine, the three main parts, duodenum, jejunum, and ileum, connection between stomach, small intestine, and large intestines, layers of small intestine, mucosa, submucosa, muscularis externa, serosa. So, function of the layers of a small intestine is digestion of proteins, carbohydrate, fats, absorption of nutrients, vitamins, minerals, and waters. We are also going to learn about arterial and venous drainage. Arterial supply branches of superior mesenteric artery. Venous drainage superior mesenteric vein supply to portal vein to liver. We are also going to learn about disorder of a small intestine, disease, malabsorption syndromes, intestinal obstruction, celiac disease. So the small intestine works silently but performs the most important task, absorption. In life too, your silent work and dedication may go unnoticed today, but they are shaping your future success. So my dear aspirants, keep learning, keep believing, and one day your efforts will shine. Let's get started. The small intestine is the longest part of alimentary canal and the most important part of the alimentary canal where the majority of the digestive function is performed, and even though the digestion of food completed in the small intestine. So the primary function of a small intestine is the food digestion of food, which is followed by the absorption of nutrients from the food, absorption of nutrient from the foods. So another function is the absorption of nutrients. Nutrients, what are the nutrients? It is helping in the absorption. It help in the absorption of nutrients, vitamins, minerals, and waters, and digestion of protein, carbohydrates, and fats. Absorption of nutrients, vitamins, minerals, and water. So in adult, the size of a small intestine is approximately 6 meter to that is 20 to 25 feet in length, and have a surface area of approximately 250 meters square. So to increase the surface area, the small intestine has a significant modification in its mucosa and submucosa layer, which is a folding in the mucosa and submucosa layer to form a multiple finger-like projection, and that finger-like projection or that fold in the epithelium, which are known as villi. So the large surface area ensure that the majority of the nutrients are absorbed during the passage of food through with the help of villi. Small intestine is the main site for the digestion of food, carbohydrate, protein, and fat. And small intestine is also the main site for the absorption of amino acids, sugar, fats, vitamins, minerals, some larger molecules produced by digestion. The chyme, as we have learned in the previous gastrointestinal tract, the chyme from the stomach is transferred to the small intestine with the help of sphincter muscle, and the name of the sphincter muscle is sphincter pylorus. So, small intestine 2.5 centimeter wide and 6 meter long. It fills most of the abdomen. It begins at the pyloric sphincters and ends with its connection to the large intestine at the ileocecal valve. Pyloric sphincters, which is present, which I have explained you already in the previous video, and then it's end with the ileocecal valve, which act as a opening and closing when it chyme transfer to the duodenum part of a small intestine. Parts of a small intestine are duodenum, jejunum, ileum. Function of a small intestine: forward propulsion of contents, movement of contents, all the nutrients. Measure it is a main site of digestion, where the digestion of carbohydrate, fat, and protein is completed in the small intestine. 90% absorption of water, minerals, vitamins, nutrients take place in the small intestine. It also acts as a protection against many infection. Hormone secretion also done by the small intestine. So what are the types of hormone we will also study in this video. It also secretes different types of intestinal juice secretion, enzyme secretion. So pyloric sphincter, as we learned, present at the base of the stomach. It is a muscular ring which is act as a gate between the stomach and the small intestine, controlling the passage of chyme into the duodenum. Movement of chyme into the duodenums, and it also prevent the backflow of intestinal content into the stomach. So it's a pyloric sphincters have a valve, and which help in the opening and closing to regulate the flow of digested food. So that digested food which is coming from the stomach, as we know that semi-digested food is a chyme, and it ensure that it moves one direction only, unidirectional only through the digestive tract. This is the reason there is a presence of valve in our body, whether it is in human heart or in gastrointestinal tract. So different types of sphincters muscle we have already learned in the previous videos. Function of pyloric sphincters is located at the end of a stomach, marking the beginning of a small intestine. From this area, chyme is transferred into the duodenum, first part of a small intestine. It remain closed most of the time. Pyloric sphincters, this muscular ring valve like structure, remain closed most of the time, but opens to allow chyme to pass from the stomach into the duodenum when you eat anything, when food is present in your stomach. That time only it opens, otherwise it remains closed most of the time. It regulates the timing and rate at which food leaves the stomach, and it also help in proper digestion and absorption of nutrients in the small intestine. And it also has ileocecal valves, which prevent the backflow of food. So it prevents biles and pancreatic juices from flowing back into the stomach. So it also prevents reflux. Reflux means preventing backflow of content. If there is a dysfunction and any problem in the pyloric sphincters, the person will suffer from pyloric stenosis. Means this muscle becomes thickened and blocking food from leaving the stomach to the intestine. Other problem of this happened with the pyloric sphincter is digestive issue. Some issues are weak or improperly functioning sphincter. Sphincter muscle is not working properly, then there is a pain in your abdomen, stomach pain, bloating, heartburn, or acid reflux also. You feel acidity and heartburn also. Feeling full after eating small amount of food you have eaten, and then you feel that your satiety is completed, your hunger is completed after eating a small amount of food. So these are the digestive issue, and fluctuation in blood sugar level also. Small intestines extend from the pyloric sphincter to the ileocecal valve. So pyloric sphincter have the valve, and the name of the valve is ileocecal valve, where it empties into the first part of where it empties into the large intestine, So the small intestine extend from the pyloric sphincter to the ileocecal valve, where it empties into the large intestine. The small intestine, where the full process digestion of completed the digestion of carbohydrate, fat and protein, all the products nutrients are completed their digestion in small intestine. Small intestine also absorbs the nutrients and passes the residue onto the large intestines. So the liver, gallbladder, pancreas are accessory organs of the digestive system that are closely associated with the small intestine with their secretion and help in the digestion of all nutrients, carbohydrate, fat, and protein. So small intestine is three types, divided into three types: duodenum, jejunum, and ileum. Image of an ileocecal valve is given where it empties into the large intestine. So small intestine extend from the pyloric sphincter present between the stomach and small intestine, and then to the ileocecal valve where it empties into the large intestine. The small intestines have different layers. The wall has a mucosa layers, outermost layer, which is made up of simple columnar epithelium, submucosa layer, which is a smooth involuntary muscle with inner layer, longitudinal layers, serosa layers. Small intestine also have been is specific surface area absorptive organs that are a circular. The name of that is the absorptive surface area of the small intestine. The small intestine, to increase the surface area for absorption of digestion nutrient, is increased by the presence of plici, circularis, villi, and microvilli. So when the digestion is completed, and another is there are 5 steps in the digestion of food. First, you have taking the food into your mouth. That is known as a ingestion, then digestion, then after digestion absorption, then assimilation, then egestion, that is a excretion of in the form of feces. So the absorptive surface of a small intestine after digestion of nutrients, there is a absorption take place which is increased by plici, circularis, villi, and microvilli. So small intestine, extending from the pyloric sphincter, the small to the large intestine. The small intestine is a tubular organ with many loops and coils filling much of the abdominal cavity. It receives secretion from liver and pancreas and help in the digestion of nutrients, which the chyme come from the small intestine. So small intestine also help in the absorption of digested food and transport the remaining residue to the large intestine. Small intestine is the longest part of portion of the alimentary canal. So yet its diameter is only about half of that of large intestine. Point should be noted. Small intestine diameter is only about half that of the large intestine. So small intestine is approximately 6 to 7 meter or more, about 20 feet in length, but only about 2.45 or 4 centimeter or 1.6 inches in diameter. Now, when there is a cadaver happen, the small intestine is smaller in a cadaver because of the loss of muscle tone. Cadaver means after the person died, there is a loss of muscle tone after death, leads to the relaxation and elongation of digestive tract, and it becomes 2-4 meter or 7 to 13 feet after the death of any person. The small intestine, now about the function of the small intestine, we have learned it help in the complete digestion of food, carbohydrate, fat, and proteins, and it also help in the absorption of nutrients. So most important thing that 90% of nutrient absorption take place in the small intestine. All the important nutrients, water, minerals, vitamins, are 90% of them are absorbed in the small intestine with the help of blood vessel and lymph. So most of the remaining absorption of nutrients occur in the travels to the large intestine. The small intestine consists of 3 portions. The parts are duodenum, jejunum, and ileum. First part is the duodenum. Duodenum is retroperitoneal in position. It means duodenum is mostly retroperitoneal, meaning it is fixed. Duodenum is fixed in position, lying posterior to the abdominal wall. Duodenum is fixed in position and duodenum is lying posterior to the abdominal wall, behind the abdominal wall, and covered by layer of peritoneum only on its anterior surface. Duodenum is mostly retroperitoneal. It means it is fixed posteriorly to the abdominal wall and covered by peritoneum layer only on its anterior surface, except for its first part, which is intraperitoneal. Intraperitoneum means something which is located within the peritoneal cavity, which is the space in the abdomen that contain organs. Like peritoneum cavity, there is a presence of few organs. Organs are liver, stomach, and intestine. The lining of small intestine has approximately 800 transverse folds, and that 800 transverse folds are called plici circularis. Important point, my dear students. The lining of a small intestine has approximately 800 transverse folds known as plici circularis, and they do not disappear when the small intestine is filled, unlike the rugae of the stomach. Again, the most important point, rugae of the stomach is disappear when the stomach is filled. But plici circularis, which the small intestine has approximately 800 transverse folds, and these folds, plici circularis, do not disappear when the small intestine is filled. So plici circularis increases, what are the function of plici circularis? It increases the absorptive surface area of the small intestine to absorb more nutrients in the small intestine. So plici circularis is approximately 800 large circular folds. Villi, there are also presence of villi, which are finger-like projection on the surface of this fold. Villi are finger-like projection on plici circularis, and macrovilli are microscopic projection on the individual epithelial cell of the villi. Kindly note down, plici circularis are approximately 800 large circular folds in the small intestines, which help in the increasing area of surface area for absorption of nutrients. There are presence of finger-like projection on the surface of these plici circularis are called villi. Macrovilli are macroscopic projection on the individual epithelial cell of the villi. So image is given, plici circularis, villi, and then above that there is a microscopic projection on the individual epithelial cell of villi is microvilli. So plici circularis are large circular fold, and it is present in the mucosa and submucosa layer of a small intestine. Very important point, plici circularis are large circular folds which are present in the mucosa and submucosa layer of the small intestine. So its function is to increase the surface area by creating folds. So it helps in the increase in surface area for absorption of nutrients, and it also slows down the movement of digested food and provides more time for absorption. It also slows down the movement of digested food because there is large circular fold. So it also slows down the movement of digested foods and increase the time for absorption of nutrients. Villi are finger-like projection that cover that present on the surface of the plici circularis. So each villus is a singular one. Each villus is rich in capillaries and lacteals. Lacteals are, there is a presence of capillaries and lacteals. Lacteals are lymphatic vessel present on villi. So it helps in the absorption of carbohydrates and protein into the blood and lymphs into the lymph. Villi are tiny finger-like projection that cover the surface of the plici circularis, which are large circular fold on small intestine, present in the mucosa and submucosa layers of the small intestine. Villi, there is a finger-like projection that cover the surface of the plici circularis. It is enriched with blood capillaries and lacteals. Lymphatic vessels are called lacteal. It helps in the absorption of carbohydrate and proteins into the blood, carbohydrate and proteins into the bloods, and fat into the lymph, lipids into the lymph. So it importance of villi. Then there are presence of microvilli also. So microvilli are microscopic projection on the surface of individual epithelial cell that form the villi. So often referred to as brush border. Microvilli are macroscopic projection which are present on the individual epithelial cells that form the villi. So this is the reason it is known as brush border. Brush border means microvilli. So it also main function is to increase the surface area at the cellular level and significantly plays important role in increasing the surface area for nutrient absorption. So together these three structures, villi circularis, villi, macrovilli, help in the efficient absorption of nutrients from food after digestion completed in the small intestines. So it is estimated to be over 600 times greater than a smooth tube. So these structures create a vast surface area which is estimated to be over 600 times greater than a smooth tube, which help in the greater surface area for nutrient absorption. So, at small intestine occupies the lower abdomen and your pelvis. Three parts: duodenum, jejunum, and ileums. The diameter and morphology of a small intestine gradually change toward the large intestine. It is duodenum is retroperitoneal space fixed in the place, and anatomical space behind the peritoneum of the abdominal cavity. But the jejunum and ileum lie intraperitoneally, means it is within the peritoneal cavity which covers these organs, means stomach, liver, etc. Next to the large intestine. The small intestine is attached to the posterior abdominal wall by a membranous double fold of the peritoneum, which is called mesentery. Mesentery. The small intestine is attached to the posterior abdominal wall, posterior abdominal wall, posterior abdominal wall by a membranous double fold of peritoneum, which is called mesentery. So these structure allow the small intestines to be mobile, to move and change its location depending on the body position. So small intestinal structures are relatively mobile, and change its location depending on the body position. Also in jejunum and ileum, the second and third part of a small intestine are covered by greater momentum, and apron-like structure. The what is an omentum? Omentum is a double fold. Omentum is a double fold of peritoneum which extend between the stomach and large intestine transverse colon, attaching them to one another. We are going to learn more. So peritoneum, look at image there. It is of two type, parietal and visceral. So peritoneum is a thin serous membrane which help in the lining of wall of the abdominal and pelvic cavity. So peritoneum is a thin serous membrane. A serous membrane means it is a thin lining of what type of cell? Mesothelial cell, which are supported by connective tissue. These are supported by connective tissue layer, and it secretes serous fluid. And these fluids help to reduce friction between organs and body walls. So these are the importance of having peritoneums, because peritoneum reduce friction. It secretes serous fluids which help in reduction of friction between organs and body walls, allowing them to move smoothly, glide smoothly. So peritoneum is a thin serous membrane lining of mesothelial cells supported by a connective tissue. It is of two types, visceral and peritoneum. So parietal peritoneum is lining the wall of the abdominal and pelvic cavities called parietal peritoneum. Visceral means covering the existing organs, which is filled with the blood vessel, visceral peritoneum. So the peritoneum space between the two layers is the peritoneal cavity. So peritoneum is the lining of entire abdominal cavity, while the omentum is a double layered fold of peritoneum. Points should be noted. Peritoneum is the lining of entire abdominal cavity. Serous abdominal lining of mesothelial cell of connective tissue of entire abdominal cavity, while the omentum is a double layered fold of momentum, peritoneum that extends from the stomach and contain fat and immune cell. The peritoneum provides lubricates organ to prevent adhesion and supports neurovascular structure, whereas the omentum, which is a double layered fold of peritoneum, so it provides physical supports to organs and act as a barrier and it act as a barrier and conduit with the abdomen, and all the movement take place with the abdomen. So peritoneum is a thin serous membrane that lines the entire abdominal cavity. It is a parietal and visceral. Parietal line the abdominal and pelvic walls. Visceral visceral covers the external surface of abdominal organs. So peritoneum function provides lubrication, prevent organs from sticking to one another, means provide adhesion, and act as a conduit, means a path for nerves, blood vessel, and lymph vessels. It also contains peritoneum microvilli to increase surface area and specialized cells that can convert to fibroblast for wound healing. Very important point, peritoneum contain microvilli to increase surface area for absorption. Second, it also consists of peritoneum specialized cell that help to convert to fibroblast, which help in during the wound healing. It helps in wound healings. Peritoneum also has phagocytic cell to protect against infection. So these are the function of peritoneum. So extending from the pyrolic sphincter to the large intestine, the small intestine is a tubular organ with many loops and coils filling much of the abdominal cavity, liver, laser momentum, and then falciform ligament, which I explained already, stomach, greater omentum, pancreas, mesocolon, then duodenum, transverse colon, large intestine, mesentery proper, small intestines, rectum, urinary bladder, peritoneal cavity, which are the folds of peritoneous membrane. Blood capillaries, it is a structure of small intestine. Mucosa, which is folded into villi and crypts. And the epithelium covers the lamina propria, connecting tissue containing abundant many blood vessel and lymphatic vessels. So we are going to learn this one also. First, to know about the mesentery, which are formed by the folds of peritoneum membrane, suspends portion of the small intestine from the posterior to the abdominal wall. So, small intestine is supported by mesentery. Mesentery, look at an image. It is a mesentery, supported by mesentery. Mesentery is a double-layered peritoneal fold. Double-layered peritoneal fold means serous fold, mesothelial cell, connective tissue. So, attaching to its posterior abdominal wall, which allows for movement of small intestine mobility and also provide access for blood vessel and nerves. So mesentery is double-layered peritoneal fold attaching it to the posterior abdominal wall, which helps the small intestine to be mobile, to move and access for blood vessel and nerves. Now the greater omentum, another peritoneal fold, drapes over the jejunum and ileum, connecting the stomach to the transverse colon. So stomach to the transverse colon help in the greater omentum, which is a peritoneum fold, double layer fold, peritoneum folds which connect the jejunum and ileum, connecting the stomach to the large intestine part, transverse colon. So what is a mesentery? So mesentery is membranous fold of peritoneum that attaches the jejunum and ileum. Jejunum and ileum to the posterior abdominal wall. Function is it holds this part of the small intestine in place and allows them to be mobile, to move. So mesentery also contain necessary blood vessel, nerves, and lymphatics that supply the intestine. Then there is a presence of greater omentum. Greater omentum is apparent like double fold. I'm going to show you an image also. Peritoneal structure. Location. Greater omentum is hangs from the stomach. Greater omentum always hang from the stomach and extend down over the coil of the small intestine, specifically the jejunum and ileum. So greater omentum, which is a peritoneum fold, drapes over the jejunum and ileum, connecting stomach to the transverse colon. So stomach greater momentums connecting to the transverse colon. So greater momentum image is given about that greater momentum which connects the stomach to the transverse colon of large intestine. The peritoneum and mesentery are both related to the abdominal cavity, but there are distinct structures. Peritoneum is a serous membrane lining in the abdominal cavity and its organ, while the mesentery is double layer of peritoneum that suspend and support the intestine. So these are the differences. So peritoneum, two layers we have learned: parietal and visceral, secrete serous fluid, help in lubrication, and then mesentery is a specialized part of visceral peritoneum. That mesentery is a specialized part of visceral peritoneum that attaches the intestine to the posterior abdominal wall. So mesentery help in the attachment of intestine to the posterior abdominal wall. So mesentery is the specialized part of visceral peritoneum. Specialized part of visceral peritoneum, mesentery. So it helps in the attachment of intestine to the posterior abdominal walls. It is a double layer of peritoneum with the presence of blood vessel. Mesentery, there is a presence of blood vessel, nerves, lymphatic vessel running between the mesentery, which I have shown you in image in previous videos. It provides structural supports and allows for the movement of the intestines. So now omentum, a double layer fold of visceral peritoneum that hangs from the stomach. Greater momentum hangs from the greater curvature of the stomach like an apron over the intestine. Laser momentum extend from the stomach laser curvature to the liver. Greater momentum hangs from the greater curvature of the stomach like an apron over the intestine. Laser momentum extend from the stomach laser curvature to the liver. So laser momentum to the liver. Greater momentum to the stomach to the large intestine. So function of momentum, which is a double layered fold of visceral peritoneum that hangs from the stomach, contains fatty tissue for fat storage and abundant lymph nodes, contain macrophages and lymphocyte also to fight against different types of abdominal inflammation and sepsis, provides mobility movement to the visceral organs, and it help in wound healing. Very important points. It contains growth factors and stem cells that promote tissue healing and regeneration. Very important point. Momentum consists of growth factors. It consists of stem cell that help in tissue healing and regeneration during wound. So it helps in wound healing. It also helps in surgical aid in surgery. The omentum can be used to patch damaged organ or to drain collection of fluids. So very important function. It also helps in immune response. The omentum contains numerous lymph nodes and immune cell which are known as milky spots. So milky spots are present in the omentum of small intestines that are involved in fighting of infection and activating the immune system. It also acts as a store fat and act as energy reserve. So these are the function of momentums, which are the double layer fold of visceral peritoneums that hangs from where it hangs. It hangs from the stomach. Greater momentums hangs from the stomach. Lesser momentums from the stomach to the liver. So lesser momentum from the stomach to the liver, greater momentum from the stomach to the Large intestine, transverse colon. So it is of three types: small intestine, duodenum, jejunum, and ileum. Duodenum is approximately 20 to 25 centimeter of the small intestine, and the structure is C-shaped. That duodenum receive bile duct, liver, and pancreas secretion open in the duodenum. Secretion from this gland neutralizes the acidic content of chyme, which is coming from the stomach, and further help in the digestion of all nutrients that are protein, fats, and carbohydrates. So duodenum receives the secretion from all pancreas, liver, bile duct, and help in the digestion of nutrients, and in the digestion of these nutrients, and also neutralize the acidic content of chyme. And in the duodenum, there is a small intestine, there is a presence of bicarbonate, which act as a help in the neutralization of hydrochloric acid, acidic chyme. The duodenum is also characterized by retroperitoneal because fixed in the position, and the end which emerges from the peritoneum marks the beginning of the jejunum. The jejunum is almost two-fifths of the whole of a small intestine, extend till the ileum, which terminates at the where it terminates at the ileocecal valve. Jejunum terminates at the ileocecal valve. Jejunum terminates at the ileocecal valve. So ileocecal valve, colon, valve, ileum, duodenum, jejunum, ileum. So ileocecal sphincter is there, ileocecal valve is there. Emptying the ileocecal valve, pressure or chemical irritation in cecum inhibits peristaltis of ileum and excites sphincters. Fluidity of content promotes emptying, help in the excretion. There is a pressure and chemical irritation, relax sphincters and excite peristaltic movement take place, and the movement of the feces take place in the large intestine. So small intestine, duodenum, large intestine, rectum, anal canal, small intestine. Duodenum is about 25 centimeter or 10 inches long, 5 centimeter or 2 inches in diameter, and relatively immovable. Immovable. Point should be noted. Duodenum is immovable. It is C-shaped structure. Posterior to the parietal peritoneum. It is retroperitoneal in position by passing anterior to the right kidney and upper three lumbar vertebrae. Duodenum is curved around the head of the pancreas. It is curved around the head of the pancreas, look like a C-shaped structure. It functions as a mixing area, receiving chyme from the stomach and digestive secretion from the pancreas and liver. So duodenum receive chyme from the stomach and digestive secretion from the pancreas and liver. So duodenum is the shortest portion of a small intestine, yet has the most important interesting function. Bile duct delivers bile from the liver. The main pancreatic duct bring pancreatic juice from the pancreas. So these duct, pancreatic duct, bile duct unite in the duodenal wall at the hepatopancreatic ampulla. So bile duct delivers bile from the liver. Then pancreatic duct brings pancreatic juice from the pancreas. And these duct, bile duct and pancreatic duct united in the duodenal wall of a small intestine at the hepatopancreatic ampulla, which look like a bulb and open into the duodenum through the major duodenal papilla. Major duodenal papilla. There is a presence of hepatopancreatic sphincter, which act as a smooth muscle valve that control entry of the substance from the liver and pancreas, and this valve also act as a prevent reflux, means prevent backflow of bile secretion, pancreatic secretion. The remainder of the small intestine is more mobile, lying free inside the peritoneal cavity. Jejunum is proximal 2/5 of the small intestine, is about 2.5 or 8/5 in length and about 4 centimeter or about 1.5 inches in diameters. So it helps in the linking of duodenum Jejunum is the second part, so it helps to connect the duodenum with the ileum. Most chemical digestion and nutrient absorption occur in the jejunum. Very important point. Please note down. Most chemical digestion with the help of enzymes and nutrient absorption with the through blood vessel and lymph occur in the which part of a small intestine? Jejunum. So jejunum along with the next segment appears like coiled sausage in the central lower abdominal cavity. So the final segment of the small intestine is called the ileum, which is not distinctly separate from the jejunum but has a small diameter with a thinner, less vascular, less active wall. So it is the ileum is the longest part portion of small intestine. Ileum is the longest portion of a small intestine, totaling about 3.6 meter or 12 feet in length. Ileum ends at ileocecal valve, which control the flow of substances from the ileum into the large intestines. Ileocecal valve act as a same as it prevent reflux, which is present between the small intestine and large intestine. The mesentery is a double-layered fold of peritoneal membrane that suspend the jejunum and ileum from the posterior abdominal wall. The mesentery support blood vessel, lymphatic vessel, nerves that supply the intestinal wall. A double fold of peritoneum membrane, which is called the greater momentum, drapes from the stomach over the transverse colon and folds of a small intestine, which I explained you. If the alimentary canals walls become infected, if the infection happen in the alimentary canal wall, the greater momentum cell may infected, may inflamed. If inflammation happen in the where? In the greater momentum cell. It's helping to prevent the infection, and this greater momentum help intestine, small intestine, to prevent the infection from spreading to the peritoneal cavity. So if the alimentary canal walls become infected, the greater momentum cell may inflamed. Inflammation happen in the greater momentums, and greater momentums, which is a double layer of peritoneum fold, it helps to prevent the infection. It does not allow the infection to prevent from to the peritoneal cavity. Now, there are many types of ligaments: gastrolineal ligaments, which is also called gastrosplenic ligaments, which is a double-layered peritoneal fold that connects the greater curvature of the stomach to the hilum of the spleen. Gastrosplenic ligament. Gastrosplenic ligament is also called gastrolineal ligaments, which help in the double-layered peritoneal fold that connects the greater curvature of stomach to the hilum of the depression of the spleen. So it is a part of greater omentum and contain the short gastric vessel and left gastroepipolic artery and vein. So this ligament, gastrosplenic gastrolineal ligament between the stomach and hilum of the spleen. Now next ligament is a frenulocolic ligament. Look at an image, frenulocolic ligaments, which is connect the left colic splenic flexure of the colon to the diaphragm. Colon to the diaphragm. Supporting the splenic flexure of the colon to the diaphragm. So supporting this, it helping to support the spleen and separating spaces within the diaphragm, within the separating space within the diaphragms. So preventing its downward displacement, it should not displace downward and act as a barrier to the spread of infection. This frenulocolic ligament connects the left colic splenic flexure of the colon to the diaphragm. Next is gastrocolic ligament, which is a double-layered fold of peritoneum. Gastrocolic ligament, which is double-layer fold of peritoneum that is part of greater omentum connecting the greater curvature of a stomach to the transverse colon of large intestine. So it contains the gastroepipolic vessel and associated lymphatics. This ligament serve as the serve as the anterior wall of the lesser sac or omental bursa and plays important role in providing the anatomy and shape to the abdomen, particularly in relation to the stomach, large intestine, colon, and pancreas. So, small intestine. Now, about this neural connection of small intestine. Small intestine is served by parasympathetic nerve fibers from the vagus nerve. The small intestine is served by parasympathetic nerve fibers from the vagus nerves. Look at an image. Is served by parasympathetic nerve fiber from the vagus nerve and sympathetic nerves fibers from the thoracic nerves. Vagus nerves by parasympathetic nerves fibers and sympathetic nerves from the thoracic nerves. Thoracic nerves. Thoracic nerves. Both types are relayed via the superior mesenteric and celiac plexus. Arterial blood is supplied mostly from superior mesenteric artery. The similarly rooted veins mostly drain into the superior mesenteric vein. So oxygenated blood is supplied to the small intestine from the superior mesenteric artery, and the same the deoxygenated blood most drain into the superior mesenteric vein. Nutrient rich blood from the small intestine drain through this vein. Nutrient rich blood from the small intestine drain these veins to the hepatic portal vein and then is carried to the liver. Very important point. Nutrient rich bloods carried from the small intestines with the help of these veins, superior mesenteric veins, to the hepatic portal veins, and then it is carried to the liver. So parasympathetic fibers from the vagus nerve and the sympathetic fibers from the thoracic nerves travel through the celiac and superior mesenteric plexus to reach the small intestine. Arterial blood, oxygenated blood is supplied primarily by superior mesenteric artery, while the superior mesenteric vein collects blood, then flows into the nutrient filled blood also flows into the hepatic portal vein, and then it is transported to the liver. So that blood is also nutrients rich blood from the small intestine drained through this vein to the hepatic portal vein and then is carried to the liver. So parasympathetic nerves fibers originate from vagus nerves, help in the increased small bowel secretion and movement, motility. Sympathetic fibers function is stem from the thoracic nerves and it provides prevention signal, inhibitory signals to the small intestines and help in the fight or flight response. Stress response. Relay plexus is also there. Both type of fibers, parasympathetic and sympathetic fibers, pass through the superior mesenteric and celiac plexus before innervating the small intestine. So arterial blood supply by superior mesenteric artery, venous drainage into the superior mesenteric vein. Portal system, the nutrient-rich blood from the small intestine entered the superior mesenteric vein, then travels to the hepatic portal vein. When it carries to the liver for processing. Very important point. The nutrient rich blood from the small intestine enters the superior mesenteric vein, which is a venous drainage, and then travels to the hepatic portal vein to the liver for further processing. So it is about an image. So I will teach this all in one separate video, sympathetic fibers and parasympathetic fibers and how it travels. So vagus nerves connects to all the organs in your chest and now the question may arises, what are vagus nerves? So vagus nerves connects to all the organs in your chest and abdomen that you never think about what are critical for your survival. So vagus nerves connects your heart, your lungs. Look at an image, vagus nerves. It is an image of vagus nerve. These are all vagus nerves which connects your heart, your lungs, your liver, spleen, and all the organs which involve in the gastrointestinal system. Kindly note down. So vagus nerve is important part of your parasympathetic nervous system, which help in your day-to-day function, which help in your heart beating, your lungs to breathe, digestive system to help in digestion, and so more. So, parasympathetic nervous system is associated with rest and digest function. It is totally different from sympathetic nervous system, which is totally related with the fight or flight or stressful situation, stress situation. So, vagus nerve help you to regulate your blood pressure, heart rate, sleep, your mood, your breathing, bladder function, digestion, immune system. So vagus nerves connect to the all organs present in your chest and your abdomens, that are heart, lungs, liver, spleen, and all the organs which are involved in the gastrointestinal tracts. Now, intestine secretes intestinal juice, nearly 1 to liters or about 1 to 2 quarts of intestinal juice and secreted by the intestinal gland every day. Hypertonic or acidic chyme is the major causative factor for this secretion because it causes the intestinal mucosa to be distended or irritated because of the acidic nature of chyme. So in normal condition, the intestinal juice is isotonic with the blood plasma and slightly alkaline basic and between 7.4 to 7.8 pH, which help in the neutralizing the acidity of chyme of stomach. Although intestinal juice made up of water, it also contains mucus, which are secreted by duodenal glands and mucosal goblet cell. So, mucus is secreted by duodenal glands and mucosal goblet cell. Intestinal juice does not have high enzyme content because intestinal enzymes are mostly found at the breast border. I explain you the breast border microvilli. So microscopic structure of a small intestines, it has a large surface area, the length of for absorption of nutrients. So it is increased by more than 600 times by the presence of its circular folds, villi and microvilli. This specialized structure are more numerous near the distal end of small intestine, which help in the increase of absorption. The total intestinal surface area of a small intestine is approximately 200 square meters. The intestine's circular folds, plici circularis of the mucosa, submucosa are deep and do not change. It does not change. So each fold is about 1 centimeter or about 4 by 10 inch in height and function to force chyme to move into a spiraling movement through the lumen of a small intestine. So these help in the slowing down this movement, and so full nutrient absorption has time to occur. Inner wall of the small intestine has many finger-like projection of this mucous membrane, which is called villi, intestinal villi, which are slightly more than 1 millimeter or about 4 by 100 inch in length, and give the inner wall a soft texture similar to your velvet fabric. So there are many numerous villi in the duodenum and proximal jejunum, decreasing in size along the way from the duodenum to the ileum. It is decreasing from the duodenum to the ileum. The villi help to contract the intestinal contact, and villi also help it to increase the surface area to help in the absorption of digestive products. So in the duodenum, villi appear like leaves. So this we have already learned in the previous video. So villi, so So villi has a layer of absorptive simple columnar epithelium, which is consisting of enterocyte, a core of connective tissue with capillaries, and it's also consists of lymphatic capillary, which is called lacteal and nerve fibers. A villus has a layer of absorptive simple columnar epithelium. So it is made up of a what type of simple columnar epithelium? Simple columnar epithelium, macrovilli image and villi image. So a villus has a layer of absorptive simple columnar epithelium, which is consisting of introcyte. Introcytes are a core of connective tissue filled with blood capillaries. It also consists of lymphatic capillary, which is called lymphatic capillaries, called lacteal, and nerves fibers. The lacteals are actually wide lymphatic capillaries. Look at the image. Green one is lacteal, wide lymphatic capillaries. Nutrients are carried away by blood capillaries and lacteals. Extremely long and densely packed microvilli are found in the absorptive mucosa cell. Therefore, the mucosa surface appear fuzzy and referred to as breast border because of the presence of macrovilli. So, in the small intestine, the major mixing movement is segmentation, meaning a small ring-like contraction occur periodically to cut the chyme into segments and move it back and forth. So, this slows its movement. It will slow down the movement through the small intestine. So, this weak peristaltic movement take place in the small intestine, and this weak peristaltic waves result in chyme taking between 3 and 10 hours to move through the small intestine because of the presence of this villi. So over distension and irritation of a small intestine result in peristaltic rust, peristaltic movement, so which moves the small intestine contents into the large intestine quickly, fastly. So normal absorption of nutrients, water, electrolytes, therefore, does not occur in this situation when there is a take place in the fast way. So peristaltic rust result in, if there is a, this happen in the very fast absorption, it result in diarrhea and prolonged diarrhea and result in water and electrolyte imbalance. And points should be noted. I explained you previously also small intestine connect to the large intestine via a valve named is ileocecal valve. So this ileocecal valve is a sphincter which is usually constricted to keep the content of each intestine separate. After it, whenever you eat anything, peristaltis movement take place in the ileum, relaxes the sphincter to force some small intestine content into the cecum of large intestine. When you eat anything, peristaltic movement take place in the ileum of a small intestine, relaxes the ileocecal valve and sphincter muscle, which force the small intestine contents into the cecum of large intestine. It is a structure of villi, tiny finger-like projection, and its function is thin walls, thin simple diffusion of nutrients into the bloodstream. It consists of goblet cell, which goblet cells secrete mucus to protect the intestinal lining. Very important point. Villi consist of contain goblet cell, and goblet cell help in the it secrete mucus, help in secretion of mucus, which help in the protection of intestinal wall lining. Villi help in the increased surface area for efficient rapid absorption of digested food, digested nutrients. So villi plays very important role for maintaining your health and energy levels. So villi increase surface area, nutrient absorption, protein absorption. Villi also contain blood capillaries which absorb nutrients and transport them to the bloodstream, ensuring and all the important nutrients reach to our different parts of our body. Most important point, villi consist of lacteals, which are lymphatic capillaries. Lacteals help in the absorption of digested fats. Very important point. Villi consist of goblet cell, which help in the which provides mucus and protect the inner lining of intestinal wall. Villi consist of lacteals, which are lymphatic capillaries that absorb digested fats. Small intestine fold of the intestinal lining, villi, epithelial cell with microvilli. Layers of the small intestine, which we will learn in the next video. Kindly watch the next series. Thanks for watching. Best of luck for your forthcoming exam. Keep consistent, read, write and revise. Kindly watch the next